welcome you all in the series of this Panchakarma module. In today's module, we are going to discuss the therapeutic essentials of Anuvasana. I am Dr. Rajkala Patil, Associate Professor and Head of the Department of Panchakarma, Faculty of Ayurveda, IMS, BHU. So, the Anuvasana Basti, it usually done in two ways. One as a supportive treatment for the Asthapana Basti or different protocols of Basti like Yoga Basti, Kala Basti or Karma Basti, or it practiced as a Kevala Sneha Basti in the form of Matra Basti or Sneha Basti for a therapeutic intervention in many diseases. Mainly, it is used in condition for Vata for the purpose of snehana, but in some cases like Arsha, Basti like Pippaladi Anuvasana or Jatyadi Basti Taila can be given as a withstand or standalone Basti treatment. So, here are the types of Anuvasana Basti according to the dose or quantity of sneha we used for Anuvasana. It is divided into the three types. One is Sneha Basti, where 1/4 of the total quantity of Niruha Basti is Sneha is used, and in second Anuvasana Basti, that is the half quantity of the Sneha of Basti is used for Anuvasana, and in Matra Basti, the amount of Sneha digested in 6 hours when it given orally, it is taken as a dose of Matra Basti. The quantity is half of the Anuvasana Basti, that is the Matra Basti. So, as Panchakarma is concerned, for all the procedures, there are the indications and contraindications are explained or described in the text. For Anuvasana, the contraindications are those who are anasthapya or those who are not indicated for asthapana, that are indicated for Anuvasana. That is, nanuvasya evacha ye anasthapya ye tatha pandu kamala meha penis निरन्नम प्लिहा विडभेदी गुरुकोष्ठ कफोदराः अभिषन्धि भ्रूष स्थूल कृमिकोष्ठ आढ्यमारुताः पीते विषे गरे अपचम श्लीपदी गलगंडवान. These are the classical contraindications of Anuvasana. In detail, like those who are contraindicated for asthapana, those who are empty stomach, those who are having Navajvara or fever of acute fever, those who are having anemia or Pandu, that might be mostly Rasaj Pandu where the digestion is impaired. Then jaundice, of course, it is the Raktaj jaundice or Raktaj Pandu. Diabetes mellitus, for of course it's a type 2 diabetes mellitus. Hemorrhoids, if it is a severe Amavastha is there in hemorrhoids or Agnimanda is there, we cannot administer the Anuvasana Basti. Ascites, it is contraindicated for Anuvasana. Skin diseases, as Sushuta also says, Kushta Shofa Pramehanam Avashyam Asthapayat Na Kadachit Anuvasayat. So, these are the conditions where we can, though the patient is indicated for Asthapana, but it is contraindicated for Anuvasana. So, these are the conditions. This is the skin diseases also contraindicated. Then diseases like filariasis, goiter, warm manifestation, obese patient, chronic rhinitis, conjunctivitis or mandagni, these all are the contraindications for Anuvasana. So, now the coming to the indications of Anuvasana, the neurological disorders, whenever there is Vata is involved in diseases of neurons or the diseases of the deeper dhatus, the Anuvasana is the choice of treatment, because other treatment or other medicaments will not reach that much deeper level where the Anuvasana can reach or where the fat or oils can reach. The excessive dryness of the body, that is the main indication of Anuvasana, or clinically proved beyond doubt, that is it is the stuti or it is the main effect of Anuvasana, that where the other treatment cannot reach, the Anuvasana will give the results. Like for Indications, Ashtanga has written like Asthapya eva chanuvasya. Those who are indicated for Asthapana, the same indication is for Anuvasana also, Visheshat Ativarneya. Specifically, those who are having more Agni, those who are having Ruksha or dryness in the body, and those who are having only Vata disorder, this is the indication of Anuvasana. For example, in Sandhigata Vata, the Astishrunkala Adhigrita can be used for for proper treatment in Sandhigata Vata as a Matra Basti, as a Anuvasana Basti, or as a Sneha Basti. So, after giving all Shodhana also, or after all treatment also, if the patient is not getting the result, so the in Sandhigat Vata also, Astishrunkala Adhigrita will nourish the bones and it will reach the deepest level. If there is a osteomyelitis also, the Majja Basti will work better in Matra Basti form. In cancer patient, where if the patient is already taken anti-cancer treatment, or if patient is already on the uh, radiation or chemo, in such patient also Dadimadi Grita can be used for the Matra Basti or Anuvasana Basti according to the Agni of the patient, and that will solve the further complications in cancer patient. Though the pregnancy is contraindicated for the routine basti, for the yog basti or kashaya basti, but from the third trimester of pregnancy, Kshirabala Taila can be used for the Matra basti, or in the last month, in the ninth month, Anuvasana with Niruha can be given. So, Kshirabala Taila will be the choice of drug there. So, coming to the material required for this procedure, the routinely plastic polythene cover with traditional putaka or basti netra we use, or sometimes if the dose is less, glycerin syringe can be used, or the Sadguru syringe is available, which is a capacity of 100 ml, that also can be used for the Anuvasana basti. Then rubber catheter of 8 to 14 numbers according to the size of the patient or the weight of the patient. It can be used. Gloves, vessels to and Anuvasana Taila, what it may be Taila or Grita. That too the Chikkana Paka, usually Madhyam Paka or Kharapaka, Madhyam Paka or Mrudu Paka can be used for this Basti. That is, the dose should be the 1/4 of the Anuvasana. And hot water for warming the Sneha, as it cannot be directly heated on the gas. That is why the hot water bath should be used to make the Taila warm. So, this is what the Basti Netra disposable type uh, Netra we use for the Anuvasana. When the dose is more than 200 ml, this is not of use. There we use with the polythene bag and proper Basti Putaka and Basti Netra. So, coming to the pre-operative procedure, here usually the food is given just before the Anuvasana as prescribed by the physician. That too, Sushruta says Yusha Kshira Rasa, like Mamsa Rasa, can be given according to the Vyadhi or the disease by the consultation with the physician, and the dose should be the dose of the food. It should be the Padahina, like routinely what food patient take, the 1/4 part of that should be 1/4 reduced part of that diet should be taken before Anuvasana. Coming to the procedure, after taking food, patient should walk little distance or Shatapauli should be done. Then patient should be advised to lie down on the left lateral position with his right leg flexed at knee and hip, left leg kept straight and left hand below the head. Warm Sneha is taken in glycerin syringe and rubber catheter attached to it, and it should be the nirvata, it should be done that whole air from the syringe and catheter should be removed by removing the air. Wearing the hand gloves, per rectal examination is carried out to rule out loaded rectum or any other obstruction. If there is a fissure or fistula, it should not be given. That's why before doing the basti or administering the basti, PR or per rectal examination is the most important part. Then the rubber catheter is carefully introduced into the anal canal in the direction of vertebral column. Sneha Dravya should be pushed with the uniform force, not too slow, not too fast. Rubber catheter is removed slowly. The time of administration of Anuvasana, in classically it has written like uh, Shite Vasante cha Diva Anuvasyo Ratro Sharad Grishma Ghanagameshu. That means in Shita and Vasanta, the Anuvasana should be given in the daytime, and in the Shite Vasante cha Diva Ratro Sharad Grishma Ghanagameshu. And in Sharada, Grishma, and when there is rainy season or when there is uh, cloudy weather is there, during that day it should be given in night time or in the evening time. As we know, like when we administer the sneha or either grita or taila in the hot season in the afternoon, the patient will have complications or he may develop some complications. So it is written like for the choice of to get the better result from Anuvasana, it should be administered in the daytime in cold season and in the night time in the hot season. And for the daytime it has given usually just after lunch between 1 to 2 p.m. it should be administered. And coming to the post operative, patient should lie supine. Mild massage over abdomen should be given. Bend the patient's leg at the knee and buttocks are hit by his heels 3 times. The patient is allowed to lie with pillow under his thighs. Patient is advised to attend his urge whenever he get. For all purpose, warm water should be used till the sneha comes out. Patient is not allowed to eat anything. Usually sneha comes out with feces within 1 to 8 hours. It take 1 yama for the one yama or 3 yama is told the retention time for Anuvasana Basti, but mostly in the patients it comes after 6 hours or 8 hours. And if it is given in the night time, mostly it comes in the morning time only. So complications and its management, mostly very rarely we get the complications in Anuvasana or Matra Basti. Sometimes patient get abdominal pain, so the Hinguvachadi Churna, Vaishwanar Churna, Shankhavati, Samshamanivati or Abhayarishta according to the prakriti of the patient and how it manifests. These medicines can be used for the abdominal pain. If the patient is having Pitta Pradhanta or he is having Pitta Prakriti or the season is summer season, then Samshamanivati can be given. If it's a rainy season and patient is having severe bloating with symptoms of ajirna, then Hingu Vachadi or Vaishwanar can be given. And if patient is having like Kapha Pradhanta, then Abhayarishta can be given for the abdominal pain. Then there is one, uh, the best part of Matra Basti or Anuvasana is written like 1000 year lifespan for the स कुंजर बलो अश्वस्य जवे तुल्यो अमर प्रभः वीत पापमाश्रुतधरः सहस्र आयु नरो भवेत. So if we give the basti like continue basti, yapana basti or anuvasana basti, so it has written like first basti will lubricates the urinary bladder and groins, second basti will mitigates the vata localized in the head, bestow strength and color, that is the third basti, and fourth basti will lubricates the rasadhatu, fifth basti will lubricate the rakta, sixth basti will lubricate the mamsa, seventh basti will reach the medas, and eighth and ninth basti will reach the asti and majja respectively. Double of the 9, that is 18 enemas properly given cures all disorders of shukra. And once he took who took 18 enemas 18 times, that is 324 in total, in the manner described above and adopts remedial precautionary measures also, obtain a strength of an elephant, speed of a horse, brilliance like gods, gets rid of sins, become capable of retaining scriptures in mind for long time, that is Shrutadharaha, and attains a life of 1000 years. It is written in the Sushru Sahita in the Falashruti of Sneha Basti. So there are the special attention in Matra Basti also, on in Sneha Basti also, that Sneha Bastim niruham va na ekam eva atishilayet. Snehat agnivadho utklesho niruhat pavanat bhayat. Like he has clearly written that not the Sneha Basti or Niruha Basti should be practiced alone for the long time, because the Sneha Basti may leads to the Agni Vada, or the Agni will be reduced after doing the continuous Sneha Basti. That's why it should not be done continuously. Rukshat Bahuvataya Sneha Bastim Dine Dine. And in Sushruta it is clearly written, like if there is the dryness in the body, or if there is vata predominance is there, so Sneha Basti can be given every day in the such condition. So clinical application of Anuvasana, it can be used as a standalone treatment in many conditions, like osteoarthritis, what already we have discussed in the first slide or second slide of this presentation. It is used as a standalone treatment in many conditions, like osteoarthritis, osteomyelitis, paralysis, or rheumatoid arthritis, ankylosing spondylosis, with different oils. Like in ankylosing spondylosis or in rheumatoid arthritis, we mostly use the Kottam Chukadi Taila or Bruhat Sendavadi Taila, and in osteoarthritis we use Asthamayantak Asti Shrunkhaladi Grit or Bastamayantak Grita in some urethral stricture patients. That is the standalone treatment. Or in some Kushta patients, we can go for the Mahatikta Grita Matra Basti. When patient cannot take the internal Sneha, there we can use as a Matra Basti as a Snehapana also we can use as a pre-operative. When we are planning a patient for Shodhana Basti, then the Anuvasana Basti will be used as a pre-operative. If we have planned patient for the Lekhana Basti, or we have planned patient for the Vaitarana Basti or Kshara Basti, and there is like the Amavastha is there, but patient cannot withstand that much Tikshna Basti, there we use the Anuvasana as a pre-operative for that operative or for that Panchakarma. Then management of complications. Many times we get the complications with other, like in Virechana, in Basti or in Vamana. So in that conditions also we can use Anuvasana as a management of complications. So superiority of Anuvasana, of course, in osteoporosis, osteoarthritis, many treatments we have done the local therapies also, and patient is not getting result. So Anuvasana is the choice of treatment to get the better result in osteoarthritis. And of course, like specific taila or grita is used for the Anuvasana. In bleeding piles, Jatyadi taila or Pippaladi Anuvasana is the choice of taila for Anuvasana. It can be given as a Matra Basti also or Anuvasana also. In insomnia, of course, the Brahmi taila or Brahmi grita or Jyotishmadi taila can be used for the Matra Basti, and it gives better result. In constipation, of course, Pippaladi or uh, Chinchadi Taila can be used for the constipation patient. In anxiety, again the Kshirbala Taila, Chandanadi Taila can be used for the Anuvasana or Matravasi. In ADHD, Panchagavya Grita or Kalyana Grita can be used for the Anuvasana or Matravasi if the kids are there. So dose will be like small dose or Matravasi can be used. In hypertension, many times internal we cannot give many medicines, but as the Anuvasana Samyak Yoga says, it's it enhances the sleep quality, it reduces the anxiety. So in hypertension patient also we can use the Taila for the Anuvasana, or specific Grita also can be used. The indications are in Matravasi, there are very specific indications like Karma, Vyayama, Bhara, Advayana, Srikarshiteshu cha, Durbale Vata Bhagne cha, Matravasti Sadahitaha. Those who are indulged in over exercise or extra work, those who take more weight, those who are having fracture, those are who are doing indulgence in more sex, they are indicated for the Matra Basti. And the beauty of Matra Basti, it can be done on the OPD basis. There might be no complications if patient follows general do's and don'ts. There are no specific do's and don'ts for this Basti also. So, Matra Basti can be practiced very safely and very easily by the all practitioner or students. Only the thing is, they should know the what to do, when to choose, and which sneha should be used for the which Matra Basti. So, either sneha or either grita or either taila can be used for Matra Basti. Different tailas according to the condition of the patient. Only the thing is, the doctor should know how to assess the Amavastha and Niramavastha to use the Matra Basti or Anuvasana is the most important thing. Thank you all.